welcome to my channel. Here again, Scarla Black Chica. And today, in this video, ipapakita ko sa inyo ang aming presentation nursing aid student here in Singapore. We are a domestic helper but we are studying nursing. We have a case study before matapos ang aming course o kailangan naming mag-research o present ang aming case study para magkaroon kami ng iba't grades at makagraduate kami. Let's go! Tunghayan natin ang mga tagpo. This case study is composed of different groups. Group 1, Group 2, Group 3, and Group 4. Here's all the groups. This is a Group 1. And the case study next is the Group 2. Of course, the Group 3. And of course, the group.
Good afternoon, panelists. We are Group 4. Our group name is Golden Memories. Our case study for today is about dementia. Our group is me, John, Annalyn, Fitzy, Fairlane, and Sononi. So why are we doing this case presentation? Really, what we want to do is to understand dementia, what are the different risk factors involved, what are the signs and symptoms.
Ayaw mo-click? Ayaw mo-click. Naka-slideshow ba siya? Okay.
And different types of symptoms and risk factors. We also want to recognize that this is a geriatric syndrome or something that usually happens with older people. So some of which can be improved, especially if it's reversible type of dementia. And what can we do to compensate those patients? One of the specific objectives for this study is really to understand the pathophysiology, what are the signs and symptoms, how do we diagnose the dementia, treatment and prevention, and lastly, how do we apply the proper nursing intervention, and especially how can we communicate properly to the patient. So the next section will be the definition.
Definition. What is dementia? If you heard the word dementia, what comes in your mind? People say disease, normal part of aging, forgetfulness. That's wrong. Dementia comes from the Latin word "de," apart, comes from a genetic word "mentis," meaning mind. Dementia is not a specific disease. It is a general term used to describe a cognitive function. Also a collective name of a progressive symptoms that will damage our brain. If our brain will be damaged, it will get worse and will be affected our memory, thinking, behavior, psychological, and emotion. According to the UK, there are 200 subtypes, and it is also can be classified as reversible and irreversible. Bigger dementia is Alzheimer's disease, the most common dementia, 62%. Vascular dementia is 17%. Mixed dementia is 10%. Lewy body dementia is only 4%. Frontotemporal is 2%. Parkinson disease 2%, and others is 3%. Next step.
So the pathophysiology dementia, most of us may know someone who is having some kind of dementia, but how do we treat them? How do we approach them? Dementia is, as mentioned earlier, it's a group of different symptoms. That's why it's very difficult to understand properly. Some of the common causes or causes that we find for dementia is, for example, Alzheimer's disease. It's the most common form. Earlier also was mentioned about 62 to 70%. It's caused by the rapid degeneration of the brain by the formation of the plaques and protein tangles. So what happens is when the plaques and protein tangles happen, it will release some kind of chemicals or what we call as a neurotoxin that can kill the brain cells, the nerve cells. So it will change a person's ability to learn, to communicate, to remember, and difficulties in carrying out their everyday function as well. What are different risk factors for Alzheimer's, for example? Age is one. Mostly the people that have Alzheimer's are older people, mostly. Also, most of us will have some type of gene that can cause Alzheimer's disease. But what we found out is those that have early onset dementia is a very specific protein that's most highest number, which is what we call as the apolipoprotein E or APOE. Also, genes play a part, so that's why family in the first degree can be a cause for Alzheimer's disease. Oops. So, some things that we found out that if a person has Alzheimer's disease, he has many behavioral changes as well. You can have very irritable, have depressive symptoms, anxiety, very hostile, or sometimes apathy, they don't care at all. They also have what we call as changes in the sleep-wake changes, like sundowning, for example. Afternoon, they think it's morning, but actually it's not. So another form of, for pathophysiology, another source of dementia would be vascular dementia, which is caused by ischemic injury to the brain. So, for example, if a person has stroke or his blood vessels in the brain has damage. So what happens, for example, for hemorrhagic stroke, the blood vessels will rupture and some of the blood will go to the brain. Another one will be the ischemic stroke, where the blood vessels will have blood clots. So what's common for this one? Oxygen is not passing through the brain. Thereby, it will will have an increased form of possible dementia. It's also more common in men.
Rowie. Tell me, Rowie.
Patients have problems of speed of thinking, speed of concentration communication. Now they're very slow on thinking, communication. So the risk factors, hypertension. We know that if you're a hypertensive person, you have higher chance of developing stroke. Diabetes is also a lifestyle disease. It's usually you have diabetes, you have hypertension, again as a possible risk. Smoking, because oxygen is not traveling back into the brain. Okay, another form of dementia will be dementia of Lewy bodies, which is formation or accumulation of a Lewy body or another type of protein in the brain. So it will block the nerve cells to properly give the right messages inside the brain. So it affects parts of the brain that controls our movement or sensory information, meaning if you have like seeing, you're hearing, you're tasting. These people will have disturbed sleep or visual hallucination. Lastly, just a last example again for pathophysiology is what we call frontotemporal dementia. So our brain has what we call as frontal and temporal lobe. So these manages many things in our body like movement, control, emotion, problem solving. So when this happens, if there's any damages, the brain will have degeneration or shrinking, and it will affect how we control our character, or behavioral changes, language changes. Usually occurs in middle ages. Another term to call this is the disease or frontal temporal dementia, frontal lobe dementia. So the next section will be signs and symptoms.
Signs and symptoms, people with dementia experiencing loss of memory, like forgetting their appointment or forgetting something that they don't remember. And also, poor judgments or reorganizing their doctor appointment also. Confusion, they confuse what is the name of these people. And also, they have difficulties in speaking and understanding, writing and reading. They have also wandered or getting lost. Even ama or akong is living with their this house with 10 years or with their neighborhood, but sometimes they forget to going back home. So get lost. Trouble in handling money, like trouble in paying their bills. Like examples, they have bills, 4 bills at month, but they pay 5 bills not normal. Repeating some question. People with dementia is they like to tell story or they like to repeat again the question. Or where's my key? Where's my wallet? Like that. Or sometimes they say, why you don't give me my lunch? I haven't eaten my lunch. I want to eat. I want to eat. I want to go home. I want to go sleep. Also saying like that. And use unusual words to identify the object. Instead of cup, you say that is a glass of water. They can no longer do their daily routine, like example, your ama before is they like to cooking, but actually they forgot to cook Are they taking longer? Like we want to take the one thing, go it back again, and go it back. So we cannot finish until later. Hallucination, seeing something but not real. Also, sometimes they don't care other people feelings, and loss of interest of them. Like a social life. Before they like to go shopping, they go party, but suddenly they don't like anymore to just stay at home. So they're not also interested about their health. Next.
So the next section is diagnosis. So diagnosis, again, earlier, because it's a set of different symptoms, it's not a disease, so that's why it's very difficult to, it's very challenging to diagnose properly. The doctor must recognize the different patterns and the changes in the behavior, the changes in the loss of skills, also in the functions. So what we do is we will have multidisciplinary approach. Multidisciplinary approach where we can have cognitive testing or neurological testing. Cognitive testing is the doctor will evaluate the patient's ability to think, language skills, math skills, or how they move. Also, we can do neurological testing, like for example, we will do brain scans. Why brain scans is important? Earlier, we have seen that the brain degeneration is shrinking. So when we do brain scans, like for example, CT scan or computerized tomography using X-rays, or we do MRI, magnetic resonance, using magnetic waves, and PET scans or positron emission tomography using radiation to scan the body cavities, we can see the different changes in the brain structure or in organs in the body. Additionally, we can do lab tests. Blood tests, for example, if you have vitamin B12 deficiency, it may show some kind of brain problem. Genetic testing, some people will have, if their parents or grandparents have this type of disease, if they have genes, the doctor can have a testing to see that, this person, his grandfather has done this, so maybe he has a higher chance of developing. Earlier today, I think if everyone knows actor Chris Hemsworth, he said he will stop acting because they found out he has genes in him that might develop through dementia or Alzheimer's disease. Psychiatric evaluation.
And this is now our answer and question and of score awarding. So we are got a best presentations and best research, and of course John get the best student in this presentation. Thank you guys for watching, at sana'y mayroon kayong natutunan sa case study namin, at maraming salamat. If you're not subscribed in my channel, please subscribe now. Thank you and good luck. Thank you to all. See you again in my next vlog.